Sorry about that. I was just finishing up some notes about my previous patient. I told them not to touch anything that you don't know what it is, but sometimes people can't help themselves. Oh, they're fine. They're fine. Okay. All right. Hi there. It's nice to meet you. My name is Dr. K, and I am the Chief Medical Officer on this starship. I understand you are a new recruit. Wonderful. Wow. Again, so nice to meet you. Welcome to our starship. Is this the first time that you've ever been on a starship? It is. Okay. Wow, so you just graduated from the academy? Right. You must have had some absolutely fantastic scores to be able to get on our ship. Yes, well, because we are tasked with exploration, we are one of very few ships that do that. It is very hard to get onto our ship. We request the best of the best for obvious reasons, so congratulations to you. It's going to be the start of quite the journey. So, speaking of the start of things, before any new recruit comes to our ship, we need to go over some medical history, just so that I have that in my files. So if anything goes wrong, I can always take a look at it, or if you don't feel well, it's just nice to have. I understand that they sent over some records from the academy, but I do like to go over the medical records, patient to doctor. This way, if you have any questions or anything, if anything was maybe put on there wrong, I just want to make sure that we got everything on there, so that we can take care of you on this ship. Okay? Good. So I may be asking you some very personal questions. Is that okay? Good. Perfect. Of course, I am here to help you, so please don't be embarrassed about anything. I mean, trust me, everybody here on the ship has gone through the same thing. So, yeah, I just want to pull up a new health history. Okay. All right. So, let's start from the top, shall we? In terms of cardiovascular issues, so heart and blood flow problems, let me know any of these that apply. Stents, atrial fibrillation, high cholesterol, heart attacks, valve problems, congestive heart failure, or high blood pressure, or other issues of the heart or blood flow. Okay? Okay? Okay. No problem. Next. Okay. Pulmonary issues or lung disease. Again, all that apply. Asthma, COPD, emphysema, okay, sleep apnea, history of tuberculosis, chronic bronchitis, or history of pneumonia, okay. Good, okay. Renal and renal issues, so kidney or urinary tract diseases, Did you ever have kidney stones, enlarged prostate, urinary incontinence, erectile dysfunction, history of bladder infections or UTIs, bladder prolapse, anything other? Okay. Okay, history of bladder, renal. Okay, next. Any neurological issues here? So the brain and nervous system diseases. Any history of stroke, epilepsy, Parkinson's disease, dementia, traumatic brain injury, or ALS, Lou Gehrig's disease. Okay, any other potentials? Okay, concussion in the past. Alright. And what age were you when you had this concussion? Okay. At one point during the academy. Okay. Next. Alright. So, gastrointestinal. Any history of swallowing difficulties, inflammatory bowel disease, fatty liver, gallstones, GERD or heartburn, peptic ulcers, okay, hepatitis, irritable bowel syndrome, celiac disease, okay, colon polyps. Okay. All right, moving along, we're going to go into endocrinology or hormone disorders. So, any history of diabetes type 1, hypothyroidism, diabetes type 2, or hyperparathyroidism. Okay. Next, let's go on to head and neck diseases. Okay. So, do you have any history of sinusitis? Okay. Hearing loss? Glaucoma? Migraines? Cataracts? Ear infections? Okay, macular degeneration? Or environmental allergies? Or any other? Okay. What allergies, environmental allergies, did you find that you were allergic to? You weren't sure? Okay, it was on Earth though? What area of Earth? Okay. So it's probably tree pollen. It's okay. It's not really something that's needed to be known as we are traversing the galaxy, but if there are planets that have pollens that are similar to some Earth trees, it's good to know. Okay. Alright, next. Okay, let's see here. skeletal or joint diseases? Do you have any history of rheumatoid arthritis? Gout? Okay, degenerative arthritis? Okay. So, Sjogren's syndrome? Osteoporosis? Lupus? Any fractures in your history? Or any other autoimmune disease? Okay. You broke your arm when you were young. Okay. Where did you break your arm? And is there any details you could tell me about it that you know of? How old were you when you broke your arm? Okay. I see. Do you know how many fractures there were? Clean break. Do you have any pins or plates or anything like that? Okay. Good. Very good. Okay. That shouldn't be an issue at all. Okay. Next. Okay. So any skin-related conditions? So any that applies? Acne? Psoriasis? Boils? Hives? Eczema? Or precancerous lesions? Or any other? Okay. So you may have some moles that need to be checked out. Okay. I'll make a note of that. I'd like to get moles checked. Where are the location of the moles? Okay. There's one on your back. And one on your shoulder. Okay. We'll need a look over. Okay. Okay. We can definitely get those checked at some point. I just want to get your medical history in here. Okay. Alright, and on to blood or cancer diseases. So have you ever had any history of anemia, breast cancer, leukemia, stomach cancer, liver cancer, ovarian cancer, bleeding disorders, lung cancer, pancreatic cancer, prostate cancer, uterine cancer, blood clots, melanoma, kidney cancer, testicular cancer, cervical cancer, colon cancer, brain cancer, bladder cancer, or thyroid cancer? Okay, no, very good. Let's see. So we do like to keep up to date on testings and screenings of these things because the crew is exposed to high levels of radiation at times, depending on where you work on the ship. We do have shields on the starship that protect us from the majority of the radiation, but the stars across the galaxy, of course, do emit a lot of radiation. We do our best to protect the members of our crew, but we can't always. Thankfully, we do have cures for all these things, so there's no problem or need to worry if it is found at all. but we do need to make sure that it is found in time. So yeah, just we need to stay up to date on that, but I'm sure that you were told the risks of being on a starship. Of course, you've been through all that. Okay, next, any infectious diseases or transmissible conditions currently or in the past? Any staph infections or MRSA infection? Okay. HIV or AIDS? Okay. Herpes? Okay. Or any other sexually transmitted diseases? Okay. And remember that everything here is kept completely confidential, so no need to be embarrassed or anything like that. So, yeah. Okay. Next, moving right along. Okay, so any psychiatric issues, mental and behavioral health conditions. Okay, so depression, ADD or ADHD, schizophrenia, anxiety, alcohol use disorder, bipolar disorder, insomnia, drug addiction problems, or any psychiatric hospitalization or other issues. Okay? You have had issues with insomnia. Okay, so how often would you say you have issues with insomnia? Okay, yep. So out of 7 days of the week, how many days would you say you have issues with insomnia? Okay, that's pretty high. We may need to do a follow-up with some sleep studies or things just to make sure everything is okay, because we don't want you being tired. Okay, so on a scale of 1 to 10, 10 being the worst, it is life-changingly bad, how bad would you say your insomnia is? Okay. Alright, so any other issues here? Okay, sometimes you have issues with anxiety. Okay. Again, on 1 to 10, will you tell me, 10 being life-changingly bad and it bothers your just daily routine very much, how bad would you say your anxiety is? Okay. And 1 being some of the time, 2 being most of the time, and 3 being all of the time, how often do you experience anxiety? Okay? Okay, that's no problem, not at all. Okay. Yes, brain issues or mental issues are definitely harder for us to remedy here on the ship because it's not necessarily a disease, it's more of a deficiency, and everyone is different, but we do our best to find the right either medication or other types of help that we can. I can tell you though that for insomnia we have some very, very good resources on the ship for you. Right? Okay. Let's move on. Was there any questions or anything that you'd like to ask me? Okay. No? Alright. So we're moving on to social history. Have you ever used or do you use any tobacco products? Okay. For how long, what type, and what amount is used each day? Okay. So if you don't smoke every day, then how often would you say? Okay, that's fine. And what type? Okay. Okay. Alright, moving on. Have you ever used or do you now use recreational drugs? It's okay. You will not be kicked off of the starship. We aren't sticklers about those things, depending on what it is, but okay. No. Do you drink alcohol? Okay. How often would you say you drink alcohol? Okay, well, I will say if you do partake in alcohol, we have a very lovely bar on the starship. The bartender is fantastic, and I do recommend checking it out. Yeah, you might see me there every once in a while, so definitely flag me down if you see me, okay? Alright, do you consume caffeine? Yeah, I understand. For how long, what type, and what amount is consumed each day? Okay, and if it's not the same every day, on average? Various types. Okay, do you exercise? Okay. How often and what type of exercise do you get in? Okay. Okay, awesome. Moving on. Okay. So, do you have any known drug allergies? Okay, so for example, Afrin, codeine, latex, opioids, penicillin, iodine. Okay, drug allergies are a no. Okay. So continued any food allergies that we should be aware of. Because this ship is close quarters and we do recycle the air, of course it's filtered, but we want to make absolutely sure that there's no way any particles of any food that you have issues with could come in contact with you. So if you let me know any of your food allergies here, if it is severe, we will make sure that that food is not on the ship. Okay? Okay? How severe would you say? 1 to 10, 10 being the worst? Have you ever experienced anaphylactic shock? Okay. Any additional common allergies? we went over that one. Tree pollen, some things, very, very common. Okay, what's next here? Do you have any current medications that you're taking, including vitamins? Okay. Okay, it's always good to take a daily vitamin, absolutely. Okay, so got medications down. Alright, next we're to continue with your medical history. Have you had any past surgical history? So ear, nose, and throat surgery. So any sinus surgeries, ear surgery, ear tubes, tonsillectomy, nasal surgery, septoplasty, any of that? Okay. Okay, general surgery, any gallbladder removal, gastric bypass, appendectomy, colectomy. Okay. Okay, any orthopedic surgery, so any spine injuries, spine surgeries or joint replacement. Okay, any other that you could think of? Okay, we're going to move on to skin surgery, so any skin cancer surgery, Mohs surgery, or plastic surgery. Okay. Sometimes that can be common on our ship. When there are injuries, we are very good at reconstructive plastic surgery to make it look as though you've never been injured. Sometimes with the exploration team, they put themselves in harm's way. You can choose to be part of that team or not, so you don't need to worry about that. But if you do choose to be on the exploration team that hits the ground first on the new planets, just be aware that we have plenty of resources for help. Okay, cardiovascular, any open heart surgery, pacemaker implantation, minimally invasive valve repair, defibrillator implantation, or aneurysm repair, cardiac stents. No. Okay, neurosurgery, any VP shunt or burr hole. No other neurosurgeries. Endocrinology surgery, so thyroidectomy or parathyroidectomy. No. Okay. Urologic surgery, so kidney stone, laser therapy, or prostatectomy. Okay. No. Urologic surgery. Okay, let's see. So we're going to move on to family history. So in terms of family history, this has to do with father, mother, siblings, sons, and daughters if you have children. So, are any of these individuals deceased? Okay. What of these people would you say you have no knowledge or history on? Okay, that's fine. Or unknown history. Easy bleeding? Any of these family members? No. Diabetes? High blood pressure? Heart disease? Stroke? History of breast cancer? history of cancer in general, history of mental illnesses, history of hearing loss. Okay, any other, you'd say, any history worth noting? No? All right. So next we're going to have your immunization history. So as a human, just get the human page up here. Okay, so human immunizations, tetanus. Have you had your tetanus shot? Okay. Last year, within 5 years, within 10 years. HPV shot, MMR, flu, last year, within 5 years, within 10 years. Shingles, hepatitis A, hepatitis B, and pneumonia. Okay. Okay, preventative health. When was your last colonoscopy? You haven't? Okay. Well, we do need to... How old are you? Okay, so you might need to schedule that in a few years, depending on how long you've been here. Okay. Last bone density test. You haven't had that one either. Okay, so that one we will need to set up. I'm going to get in touch with your superior and see when you'll have a time for that. We need to make sure of these things because of space, of course. A lot of times with low gravity, we have issues with bones. Okay, more preventative health. No, it doesn't pertain to you. You are a human. Are you seeing any specialists at this time? Okay. Are there any specialists that you'd be requesting to see? Okay. Of course. Just make sure we got everything down here. No need for okay. Did you update your I see. Okay. We need to know if you are injured, who you would like us to call. Can you give us just one or two? So can you think of one person for us to call if you are injured and you need help? Okay. And last name? Okay. What is this person's relation to you? Okay. And their phone number? Okay. Pardon me. And a second one. Okay. And their relation to you? Okay. And their phone number? Okay. Perfect. Keep going. Okay, so just for like more verifications, can I get your first name, last name? What is your middle name? Okay, your current address on Earth. Okay, city. State. Okay, and the zip code. your current phone number. Okay. What is your email? I would recommend that you provide me with your Starship email that you have been given. Okay. Perfect. Date of birth. Okay. And what gender do you identify as, or would you rather me not say? Okay. What is your marital status? Okay. Your race? Closest that you would say? Okay. Ethnicity? Okay. What is your primary language? Okay. What is the last 4 numbers of your social security number? Okay, you won't really need that unless you go back to Earth for some reason. Okay. We got your contacts. Wonderful. All right, I believe that is everything. So I apologize that was very long. I do want to get a sample of your DNA so that we can create vaccines or any sort of basically, if you have any issues, we can fix it using your DNA. It's very hard to explain, but yeah, okay. Before I take anything, I need to know, do you have any current issues going on right now? Not like chronic health related. Okay. Because I've noticed you've been a little sniffly. Okay, how long have you had the sniffles? Okay. How does your throat feel? Okay, interesting. Any congestion? Any coughing, sneezing? Okay. Pardon me, I'm just going to feel your throat here. Okay, a little bit swollen. You may have a common cold here. We'll see. I'm just going to check your sinus area. How does it feel when I do this? And put pressure here. Okay. Let's see if I can drain some of your congestion here. Does that feel better? Okay. Okay, very good. Let's see if I can drain the congestion down here too. I know sometimes it can be very uncomfortable. Can you open your mouth and go ah for me? Okay. Alright. Just gonna feel your head here. Okay. I wouldn't say you have a fever, but you definitely have, your throat looks a little inflamed, and like you said, you have some congestion. So the chance you just have a very, very common cold, low grade, all that. So, and that's fine. That won't mess with the genetics at all. So, collecting your DNA so that we can genetically create things specifically for you. It's a very simple process. We have this device here, and basically all I do is press a button. I have it on your shoulder, and then I press a button and it collects your DNA. That's it. Super simple. It's painless. You will feel a little bit of a pinch, but trust me, it is very, very tiny. You barely feel it. So here, let me put my gloves back on. Okay, so go ahead and lift your shirt up for me, just up your sleeve right here. Okay, very good. I have an alcohol swab that I'm going to use to clean the area. Okay, hold still. Clean that. Good, okay. It's nice and clean and sterilized. Okay, so I'm just going to hold it right here on your arm. And in 3, 2, 1. Okay, very good. Just gonna make sure. Perfect. It got all that it needed, and you were all set. So, in terms of your cold, it should go away within the next few days. Was there any sort of pain medication or anti-inflammatories that you'd like me to prescribe you? No? Okay. Alright. And if it gets worse, please come and see me. One thing, was the academy you went to, were there a lot of other alien species? Okay, so it was on, yep, okay. Good. So you're aware that there are some types of aliens that do not mesh well with the human species. And that's fine. We just don't want to touch them when they are leaking, because it can cause some skin irritation. I just want to let you know, if you have any questions on what alien species we do not want to touch, please let me know and I can get you a list. And in terms of colds or viruses or common colds that can be transmitted through aliens, these things happen, especially on the exploration team. Sometimes we come in contact with planets that have diseases that they no longer need to deal with, but they're new to us. So we do our best to make sure that we don't have any problems with that, but any known planets that we know about that have these issues, if it's your first time on the planet, we will give you the vaccine for it. So don't worry about that. Of course, with new planets that we haven't been on before, there's not much we can do. You just have to be safe and wear your spacesuit. So, yeah. I'm sure that you'll be seeing me a lot. I'm here for everybody on this ship. If you have any questions at all, please let me know. I'm here for you. I want to make sure that you stay safe and happy and healthy. So yeah, visit me anytime with any concerns, okay? I'm going to get some things set up and scheduled with you on some of the concerns that we had. But again, I need to just speak with your officer. So we'll get that going, and then we'll get those appointments in there. So I'll be seeing you soon then. All right. Okay. Yeah. You know what? You enjoy yourself. Go explore the ship a bit. Meet all the other officers. Have you met the captain yet? No? Well, I would definitely go there next. Go ahead and say hi to the captain. Introduce yourself. She's very nice. So nice. Yeah. Okay. All right. I have to move on to my next patient. So, thank you so much for sitting here and answering these questions with me. And I will see you later. All right. Bye-bye.